Hi everyone, and welcome to Acupuncture for Pregnancy. My name is Dr. Emilie Salomons. I am a doctor of Chinese medicine at AcuBalance Wellness Center here in Vancouver, Canada. I think I treated my first patient, pregnant patient with acupuncture 16 years ago now, and I've been hooked since. I was a co-creator in the first acupuncture for pain and labor course for midwives here in Canada, and am the co-president of the Obstetrical Acupuncture Association, which is an association dedicated to the promotion of maternal acupuncture and raising the safety and knowledge in the field. So I got asked to talk about pregnancy and acupuncture. That's a really big topic for me. So I was a little bit, I was humming and hawing on how I can do it. And I thought probably the best way to go about this is actually to answer your questions. So we went through and looked at the most common questions that people asked. I thought about all the questions that everybody's asked me over the years. And we've compiled a bit of a Q&A. So hopefully this is going to be really helpful for anybody watching who's curious about how acupuncture works and how it relates to pregnancy and how it can help you. So I've got my handy-dandy computer here with some of the questions. So let's just start and see what the first question is. Okay, so first question is it safe to get acupuncture while pregnant? Now this sounds like it's a really simple question, but it's actually a really, really important question, because when we're pregnant, I feel like the mama bear comes out, right? Where we are watching everything we eat. We are sleeping on our left side. We are looking at any medication, anything. Does it affect or will it affect my baby? So it would make complete sense if you're going to be getting a treatment or any kind of modality that you'd want to know for sure that it is both safe for you and for your baby. So I think this is a really great question. Never be shy about asking something about safety in pregnancy. So the answer for it is yes. Actually, acupuncture is very safe in pregnancy, which is a really good thing because I've been doing it for a very long time. I knew this question would be asked because it is probably the #1 question that does come up. So I went through all of the research and looked at, there's a lot of studies that have been done on various pregnancy conditions with acupuncture. And what's really nice is there have also been systematic reviews that have looked at all that research to see the safety and how that plays out. Although I don't always agree with all of the research on how they chose their points or the sham they used, the one resounding conclusion that comes from all of these studies is that it's very safe. So that really helps, I think, for most people to feel really confident knowing that there are all these studies out there, and no matter what the outcome was, the one conclusion was that it was safe. I did write down a systematic review that had come out called The Safety of Acupuncture During Pregnancy, and this was by the, excuse my pronunciation, Kyung-hee University in Seoul, Korea, and the Plymouth University in the UK. And so what they did is they looked at 105 studies that were done for pregnancy. So they looked at nausea and vomiting in pregnancy studies, breech studies, pain, depression, labor induction studies, and pain relief in labor. So there was 105 that they looked at, and their conclusion was, after looking at them, was that acupuncture during pregnancy appears to be associated with few AEs when correctly applied. Now, an AE is an adverse event, which basically means that something happened that was not good and was not the intended purpose. So in the case of pregnancy acupuncture, the AEs in this case would be something like there's no evidence of research of increased miscarriage rates, intrauterine death, or premature birth, which thank goodness, because all of those things are awful. So overall conclusion is that acupuncture is really safe. The key thing I will say though is what was written in this study, and which I believe as well, is this is when it was applied correctly. And what that means is that it's provided by someone who has not only the ability to do acupuncture, but who has the training both in acupuncture and specific acupuncture for pregnancy. So I've done my 5 years of regular acupuncture training and then hundreds of hours of extra pregnancy-specific training. And so it's really important when you're looking for a provider that you're looking for someone who has extra training, because that's where the safety is going to come into play as well. All right, question number 2. Can the acupuncture needle puncture the uterus or baby? Okay, this gives me like palpitations just reading it, which is why I am an acupuncturist and not a surgeon. Obviously, I'm not cut out for sticking needles directly into uteruses. The answer is no. No, the needle does not puncture any uteruses, any babies. In fact, we do our utmost best to avoid all major blood vessels, organs, nerves, everything like that. The nice thing with acupuncture is that how it works is a lot like, say, a light. If I want to turn this light off, I wouldn't stand on a chair and unscrew the light bulb to turn it off. We have this handy-dandy light switch that will dim down, dim up, and so I can control the light in the room through this switch. Now, in our bodies, we have all of these access points, which are a lot like light switches. And so what we're doing is we're sticking an antenna into this access point where lots of information is passing through, which then triggers both a signal in our brain, in our nervous system, in our cells to elicit a specific response. So it can increase contractions in the uterus, or conversely, decrease contractions in the uterus. It can affect our heart. It can affect our nervous system. But what we're doing is we're just stimulating these access points, these light switches, to elicit responses inside our body. And that allows us to do most of our points in the limbs. However, some of the points do end up in the trunk, and this is where that extra training I was mentioning comes into play. We learn when we're training specifically with pregnancy, where the uterus is at each month, so that we can make sure that we know what's going to change between a person who is not pregnant and a person who is pregnant. Another thing would be, say, the apex of the lung. That will actually rise up as someone's pregnant. So it's important because maybe a certain needle or a depth that you would do in a non-pregnant person, you actually have to adjust it in someone who is pregnant. But generally, the main, to answer that question, the main thing is we are avoiding all major organs. I do not need to stick a needle into your cervix to affect your cervix, which is awesome because nobody wants a needle in their cervix. All right, next question. Let's see. I have never had acupuncture before. Why would I choose to do it in pregnancy? That's also a really fair question, because part of that mama bear thing is you don't really want to try new things in pregnancy, things that you're not sure about. I mean, even just the idea of having sharp metal objects put inside you doesn't really make you think, oh, relaxing. But the reason why you'd want to do acupuncture in pregnancy is because of the things I mentioned before. Because it's really safe, you have this option of avoiding things that are maybe considered less safe. I mean, in pregnancy, we don't actually have a lot of things we can do. We don't have access to a lot of medications because they affect either the baby or go through to the placenta, or it's unknown whether or not they do affect the baby. Even something like Tylenol, which is considered generally quite safe, there is some conversation about having too much. So to have an option of something that's non-pharmacological means that you actually have this option to do a treatment that you know there's nothing that's going to pass through the placenta to the baby. There's nothing that has to get processed through your liver. So it's really a nice option of something different you can do. We also treat the root rather than the branch. So a good example is actually, I had a pregnant patient who was referred to me by an obstetrician. This patient had twins, and she had been getting migraines for months. So the obstetrician said, okay, well, for whatever reasons, why don't you go to AcuBalance? And she came to see me. We did, I think by the second treatment, the migraines had completely gone. And so we had looked at, like, is it hormonal? Is it structural? What things trigger it? And we looked at, like, how can we treat the root so that they stop coming back, as opposed to how can we just numb the pain? The nice thing is that after the headaches went away, she would come in occasionally for maintenance throughout the pregnancy. I mean, she did have twins, so, you know, back pain, other issues kind of would creep up, and we would treat those. But the headaches never came back. So that really helped bring that confidence in, like, treating the root is actually a really wonderful way of being able to nip that symptom right in the beginning so it doesn't keep going on. You're not having to go back to other treatments. Question number 4. Yes, question number 4. Here we go. What does acupuncture treat? Okay, so this question is, I don't know, I feel like there's no way for me to do this without sounding like I'm doing a CLR commercial and listing all the providers that sell this product. But, you know, it's a question, you've asked it, so I'm going to answer in my best infomercial voice. Acupuncture could be for you if you have nausea and vomiting in pregnancy, hyperemesis gravidarum, headaches, migraines, heartburn, threatened miscarriage, anemia, pregnancy rashes, back and pelvic pain, upper back, rib, wrist pain, carpal tunnel, gestational diabetes, edema, anxiety and depression, irritable uterus, uterine pain, threatened premature labor, postnatal depression, pre-birth cervical ripening, induction, C-section recovery, insufficient lactation, and recurring mastitis. All right, so jokes aside, I have some favorite conditions that I do treat, though. So yes, as you can see, there's lots of things that we do treat, and essentially anyone who comes in with a complaint while pregnant, I'm going to do my best to find a way, if not to completely remove it, to make the person's quality of life as good as possible. I do have my favorite conditions. So my favorite condition, one of them would be, well, headaches. And that was a good example of why I like headaches. Headaches are so terrible, you wouldn't, if you can get rid of that, it's just the quality of life of someone is so much better. Another one I really like is heartburn. Yes, heartburn. So heartburn, I have to say I feel a bit like a magician when I treat heartburn because it resolves it so quickly. And that's not the case for a lot of things, but for some reason heartburn, I feel so amazing when I do that. But really, the patient's really happy because you have patients, you know, they're taking Tums like it is Skittles and nothing is helping. And with heartburn, you still have to be sitting up, having small meals, not laying down right after eating. But the treatment's so quick that, yeah, it's just very satisfying. Another one I really like doing is breech. Now, breech is something that there's not a lot that can be done for breech presentation other than an external cephalic version, so an ECV, which is usually done around, it changes, but around 36 weeks. So if someone comes to me before then, between 33 and 36 weeks, we've got a treatment that we do in clinic and then something that we teach the patient to do at home. And that in studies has shown to increase the head down turning rate from 49% to 75%. And there's no increased rupture of membranes, no AEs, no adverse events. So it's a really nice, easy treatment to do. I like doing that because I like educating people, I should say. I love, now this is a completely serious matter, I really love treating anxiety and depression, both in pregnancy and postpartum. And the reason for that is that it is such a huge issue. There is such a burden that is placed on someone when they are pregnant and feeling that way, or postpartum and feeling that way. There's this societal expectation that we need to be, you know, perfectly happy and so blessed by the wonderful baby we're bringing into the world or that we have brought into the world. And it can be a huge burden, and there can be a lot of shame and a lot of feelings that come around not feeling awesome and happy and giddy all the time. And so anxiety and depression is multifaceted. There's a lot of different reasons why you could get to the point where you have anxiety or depression. There can be just, the hormonal changes. There could be brain chemistry, but there's also societal pieces and how the birth is or the pregnancy goes. It's shown that people with hyperemesis gravidarum, which is like a severe form of nausea in pregnancy, have a higher rate of depression, and it's because you are physically just feeling awful. So I really think that for an issue that has multiple causes, you need to also look at multiple factors to be able to treat it. So someone getting counseling is wonderful, and someone, if they have kind of health concerns, that they're getting supported with that. But what I like with acupuncture and how that treats it is that whereas the tools you're getting from the counselor are external and you'll be able to put those in and they can be really empowering, the acupuncture can work really well with that or on its own to help strengthen the person from the inside out so that they feel more capable to be able to put the tools they're getting elsewhere into play. And sometimes that includes medications as well, but no matter what treatment they are getting, it's nice to have the acupuncture in there as well to help from the inside out. So I really do like doing anxiety and depression, and I think any support that someone going through that can have, the more support, the better. Another condition I really like to treat is cervical ripening and birth prep. Now, I prefer to call it actually birth preparation because there's a lot more to having a baby than just your cervix. There is your emotional health, there is the position of the baby, there is your strength in your body and the contractions and all sorts of pieces. So birth, probably should give another analogy. I don't know if I should, but I really like analogies, so I'm going to give another analogy. All right. When you're pregnant, if you imagine your cervix and your body is like a door that's being, dead bolted closed to keep the baby inside. So you've got the locks, you've got the deadbolt, you've got a chain, you've got all these things to make sure that the baby is not going anywhere. Then once you are about to have the baby and start the birthing process, all of those locks need to come off before the baby can then, say, hey, I'm ready, release the protein from its lungs, initiate labor, and then have the door be able to open. Now, if you imagine, if some of those locks are not unlocked for whatever reason, opening that door is going to cause resistance. And it's in that resistance that causes more discomfort in the birth and also usually leads to interventions. And there's something called a cascade of intervention where they've shown that like one intervention can lead to another, ending in usually a cesarean section or just multiple interventions. So what I do for birth preparation is look at all of those locks. So the emotional lock, the structure of the woman's pelvis and musculature and tendons, does she have spasms, what is the baby obviously head down, but how are they positioned? Is it a really nice positioning? Are they really nervous or anxious for whatever reason? Oh, I make them feel good. If someone has I've seen anxiety or exhaustion or fear actually be the sole reason why someone doesn't go into labor, because the body goes, oh my goodness, there's a tiger outside of the door. I am not letting this newborn baby come out. So looking at birth preparation means that we can actually look at all of those factors that could impact a really healthy, smooth, wonderful birth and prevent them. Part of Chinese medicine is about preventing a disease before it happens. And so when it comes to birth, it's about preventing complications before they happen in the first place. So yes, I really, really do like, as you can see, really do like treating birth preparation. Okay, let's go to the next question. I had a C-section with my first baby and would like to have a VBAC. That's a vaginal birth after cesarean. Can acupuncture help? So, yeah, see how that was some good question placement. So, VBACs work very similar to a first-time birth in the case of what the body has to do in order to open up in order to have the baby. So the first thing we want to do is play a little bit of detective. I like to think of myself as maternal Nancy Drew. So Emily Drew, detective of the birth canal. No, okay, you know what? Scratch that. That's terrible. Anyway, I do like to play detective and figure out why somebody was not able to in the first place. How far did they get along? So maybe they got to 3 centimeters installed there. Maybe they got all the way to the pushing phase, but there was something with the baby. Now, a new pregnancy means a new everything. So oftentimes the things that impacted the first pregnancy won't necessarily impact the second pregnancy, but as long as someone has been given the green light to have a VBAC, like a great candidate for it, then what we can do is we can look at all of those pieces that I mentioned, all of those locks, make sure that we're doing something different. So it's a new pregnancy. We don't want to do the same thing expecting a different result. We want to do something different to make sure that hopefully this time around they can have the result of a vaginal birth. Try to think of examples. So myself, actually, I had a VBAC. So my first labor was a cesarean, and the second one I ended up having a wonderful VBAC, really great. So I can understand also the emotional piece that comes with that. So there can be a lot of fear that comes into, am I able to do this? Can I actually have a vaginal birth? There might be, in some cases, birth trauma that we need to work through first. Some people have they went to C-section, but they're okay with it. Everything was fine and smooth. It just is what it had to be. Whereas other people actually have a lot of trauma or experiences that they need to unpack, I should say, before they go to the next birth, so they don't impact how that next birth goes. Because like I said, our emotional state, our mental state can directly affect our physical experience and our physical ability to birth. So I really do enjoy working with VBAC patients. All right, next question. Okay. I am planning a C-section. Is there anything acupuncture can do to help if it's not a vaginal birth? So, for many reasons, people choose or elect to have a cesarean section. There's this idea that if you have a C-section, you don't have to worry about pelvic floor health, you don't have to worry about anything to do with, the vagina, and the doctors are going to take care of everything, and you just wake up and you have a baby. The thing that people need to remember is that a C-section is a really major abdominal surgery, and it's not only just a major abdominal surgery, it's one that at the end you are then healing from a major abdominal surgery with a brand new human being that you are supposed to take care of, which can be a really tough place to be in. So to be as strong as possible going into the surgery will improve your chances of healing quickly, of feeling, able to take care of the baby. Another thing it can help with as well is milk production. So one of the issues that comes up with a cesarean section is that in some cases there's a bit of a delay in when the milk comes in versus a vaginal birth. And the way I see it, your body's just kind of going like, what the heck just happened? So it needs a minute before it remembers, oh yeah, there was a baby, I need to produce milk to keep it alive. So there is a delay. And when there's a delay, that can cause the baby to lose weight, which is, normal in those first couple of days, especially if milk's not coming in. But that can cause a lot of panic with the medical staff because obviously we don't want our babies losing too much weight. And then that can cause a series of events that then involves supplementation with either a donor milk or formula, and then issues with trying to reestablish the baby onto the breast and a lot of different issues. So to have someone be really strong going into the pregnancy or into the C-section, and then if I can, I also like to see someone after the C-section. If they're in the Vancouver Lower Mainland area, I do like to do hospital visits for C-section patients immediately after, usually the first 3 days that they're in the hospital, to help get milk production happening if they want to breastfeed. The other ones I like to do when someone is having a C-section is do home visits, again, if possible, in that first month, because the first month, like I said, major abdominal surgery, a lot of healing has to happen, and I think it's really important to have the patient lay in their bed and recover as much as possible. I don't need them getting up and going to a bunch of appointments other than seeing the obstetrician for the follow-up, or if it's possible, if they have like a midwife who goes to their house, or the nurse, the community nurse that comes to the house to check the scars, that's even better. But if I can, I like to go to someone's house and do the postpartum visits there. Another reason why people would come who have had elective C-sections or emergency C-sections in a postpartum situation, we'll say, is that they would come for scar pain. So part of the C-section healing process, scarring does occur to kind of seal where the wound was. And you can get almost like pulling. I say it's a little bit like when you have a Band-Aid and you're taking it off your skin and it's stuck to the hairs kind of thing. It's like this pinching, pulling pain. So for some people, part of the healing process, there's a little bit of adhesion that starts to happen and a bit of discomfort. So another reason someone would come would be to help treat the scar pain and help improve the healing of the scar. All right, so I think I've covered that one. Next, oh, this is the last question. Hey, wow, I can't believe we're already there. I didn't have enough milk with my first pregnancy. Can acupuncture help? So I should add that insufficient lactation is another one of my favorite things to treat, because the pressure that people face with whatever decision they choose when it comes to breastfeeding, again, they wanted to but weren't able to, they decided they didn't want to, there's just so much pressure around it. And so one of the worst things that can happen when it comes to breastfeeding is where you want to breastfeed, but you're being told or you feel like you don't have enough milk for the baby. There's a lot of reasons why one doesn't have enough milk. So one of them would be that basically you have enough milk, but it's just not coming out. And this can happen because of, say, the C-section, where the body just the communication hasn't happened yet, or where someone has a lot of stress or a blockage for some reason, and it just doesn't, the milk's there, but it's not flowing smoothly. And this actually is also the case in some people who are getting recurring mastitis. But basically, what we'd want to do in those treatments is really get that flow going so that the milk can actually start coming out and come out smoothly. Another reason why someone might have insufficient lactation is because they don't, in Chinese medicine we say qi in blood, so they don't have enough qi in blood. So this could be because of a really difficult birth. This could be because of a lot of blood loss in the birth, whether vaginal birth or C-section or however it happened. This could also be because of someone, for whatever reasons, didn't have enough nourishment during the pregnancy. Maybe they didn't realize and didn't have enough when it came to nutrition, or maybe they were ill during the pregnancy, or just really busy, a parent of 5, or a really stressful job. For whatever reasons, they go into the birth, or it occurs during the birth, and what happens postpartum is their body says, I've only got this much chi and blood to survive. I need to make sure that I survive before I can then start giving it away. So in this case, I find the first situation that I mentioned where it's there, but it just needs to get out, that was a lot easier. When we're talking about being really deficient and weak, we have to look at acupuncture, moxibustion, but also looking at foods and diet, sometimes Chinese herbs, to really help build up the supplies so that there's something to then share with baby. So it is something that might take a little bit longer, but it still can definitely work. I had a great experience with a patient who had twins, another twins case, and they really, really wanted to breastfeed, but they had to do a lot of pumping for it, and they were finding that their letdown was taking forever, that they didn't have very much milk that was coming into the bottles, which was really disappointing because they wanted to feed the babies, but there wasn't enough to feed the babies, so they were supplementing. And what we did is we did treatments regularly, and they found that on the days they got the treatments, they would see a huge jump in the supply that they were getting pumped. And I like to use the pumping analogy because when you're breastfeeding a baby, you can't always tell how much they're actually getting. You can't see, whereas when you're pumping, you can literally see, oh, look, I have this many ounces or milliliters. So it was really, she was so happy because she could see that her treatments were doing something. Every Sunday she would come, and that Monday she would have a jump to the next level and a jump to the next level. And then I gave her some tips of things she could do before she would pump or in breastfeed for the times that she was actually breastfeeding the babies as well. And she found that her letdown came quicker. So when she was doing her at-home homework before she would pump, she would notice that her letdown would come, 10 minutes quicker than before, whereas before she would just be sitting there waiting. So it was a really nice tool for her to be able to increase that amount, and eventually she was able to wean off the supplementing. But it was like a process, and it was a process we worked together with the lactation consultants. We were all on the same team, and the real goal was how can we just boost so that she's got as much as she possibly can without obviously draining her, or making sure that she feels really good, and then she's able to help her babies. So that was really, great. So let's see, I think that was the last question. There was something else I did want to add in though, and that is I like to, no matter who I'm treating, but especially pregnant women, I like to give a little tool, something that people can use when they're at home so that they can feel like they have more tools in their belt to help themselves or help their baby. One of the things I like the best, especially with the cervical ripening birth preparation patients, is to teach them acupressure for pain and labor. The course itself, when I teach it like in group classes, takes about 4 hours. So obviously I'm not going to sit here for 4 hours, but what I can do is I can actually teach you one point that's really helpful for the letdown and having milk come in, or conversely, this point is also really good for helping cause a downward sensation during second stage of labor, or like near the end of the first, where someone's kind of getting close to the actual baby coming out. And this is something that I would definitely say, do not do this at any other stage in pregnancy. So this is for your baby is in the process of coming out, or your baby is already out and you just want a little bit of help with your milk coming in. So the point, first I'll show you the point and then I'll explain a little bit more. So it's about to get racy. I'm going to take my top here. So what I'm going to do is I'm going to show you what you're doing to find this point. Is you are looking for the most prominent bump at the back of your neck, and that is C7. So when you put your head down, you can feel kind of this big bump, and that's C7, and then the end of the shoulder. And you draw kind of an invisible line where they meet, and what you have is this point at the kind of the nice, meaty, muscular mound. That's the acupuncture point. So in acupuncture, we call it gallbladder 21. And what this point does is it causes this descending motion. So when it's in relationship to insufficient lactation or just helping milk come in, helping let down, that downward motion really helps with the milk coming in. What you're going to do is, now acupressure is different than massage. We're not doing this motion. We're just using our thumbs. I mean, some people really get in there with their elbows, but I would say start with your thumbs. You're putting firm pressure on those 2 points. You start off soft and you kind of ease into the pressure until it's as firm as the person can go comfortably. So once you have that, you hold it for about a minute or so, and then you slowly release off. Now, in the context of birth, this might be someone, say, in their pushing stage, and you would do it with each contraction, and that would just help cause this downward, outward motion. In the case of lactation or breastfeeding, what you'd want is you'd want the woman to first latch the baby. And this, for anyone who has had to latch a baby, especially the first time, it is an overwhelming experience. You're being told about babies eating burgers, which anybody who has had to have issues with breastfeeding knows all about the burger baby thing. But you're focused on getting the baby onto the breast, and then, am I holding it right? Am I doing the football hold or the cross hold or this or that? And what happens is you finally get the baby on, and your shoulders are up like this. And you're just like, okay, baby's on. Now, partner, friend, whoever can come in, press down here, all the movement can come, all the circulation can come. It actually physically relaxes the person, and that can actually really help at getting the milk flow to start coming down into the baby. It's something that I've tried. Actually, I was teaching a group of midwives, and I had just had my first baby, I think, and I was pumping because I was on my maternity leave or just shortly after, and I was still breastfeeding, but whatever it was, in between breaks at the class, I would be pumping. And we had just covered this point and its use for lactation. So being the nerdy, sciencey kind of person I am, and this group of midwives for it, we decided to do a little test and see. So I got my strapped on, my whole thing strapped on, and then I had the acupuncturist or the midwives press on the points, and you could see, I think we did one side and not the other side, and we had the both strapped on, and you could see the letdown really come so much quicker on the side where the acupressure was being used. So that was just really neat and fun, and who doesn't want to test out the theories that they're teaching? So that was really exciting. But yeah, so I think that is everything we have time for today. If anybody has any questions of things that I didn't address, burning questions about maybe even something that I didn't even mention in my infomercial list of things we treat, I'm always open for doing a Q&A. We offer free 15-minute Q&As for anybody who's interested. So feel free to reach out. I really look forward to seeing anyone at any stage in their pregnancy And I hope that anybody watching who is pregnant has a wonderful pregnancy, a smooth birth, and a fabulous postpartum period. All right, that's all. Take care, everybody.